So I came back to this clinic and I was told I was a candidate for CAR T therapy. So to my understanding, that is taking my own cells and processing in the lab and making them smarter so that they can recognize my cancer at its current state, if it has mutated, if it's different than how it was 5 years ago, making my own dendritic and T cells and NK cells smarter so that they can recognize the cancer and kill the cancer. And I felt like that was just a way less invasive way to take care of any microscopic disease rather than radiation. My diagnosis was intraductal carcinoma, breast cancer. It was stage 2. I was diagnosed in 2020. I felt a lump in my chest just putting lotion on one day, and I let it go for a few months, and then it was still there, and I realized I need to get that checked out. So had a biopsy at home. Cancer was confirmed. Chemo was immediately recommended, and I had been aware of people who had beat cancer through a plant-based diet, and I just knew that there were other options out there. And so because of that prior knowledge, that is what made me want to pursue other options. I started looking into alternative treatment rather than starting chemo immediately. I heard about the Immunotherapy Institute through my doctor, actually. I was going to an Ayurvedic doctor, and he told me about you. And so I looked at the website, and all of the offerings that you listed, particularly the low-dose chemo, just the fact that that was even an option was really attractive to me, and the fact that it was just options that I didn't have at home. I was really interested in coming here. I didn't have an expectation. When I spoke to Dr. Perez on the phone, I was really impressed. He's very well spoken, very educated, was very thorough in what he explained, and I felt like the fact that you guys are associated with a hospital and it's not entirely alternative is great, because you have both. You have the alternative and traditional oncologic care, but you tailor it to the patient. So that is what I thought was really great. And yeah, I would say my expectations were met. You were all very professional, and I just really like the fact that you would incorporate alternative and traditional. The treatments I had were many IVs, high-dose vitamin C, B17, B17 Laetrile, zinc, selenium. I had the detoxification sauna. I had Remission. I had autologous cell transfer therapy, and more.
Did you do the hyperthermia?
Yes, I did. Yes, I did the hyperthermia. After my discharge, I went home, and at the recommendation of your doctors, I had a double mastectomy. I really only needed one, but I chose to do both, and I also had 5 lymph nodes out on my left side. That was successful. The recovery was, about 2 months. At that point, after I was discharged, I went home and had a bilateral mastectomy. I had also 5 lymph nodes out, clean margins. They said everything was good. At that time, the hospital recommended radiation. I declined it. I chose to continue with alternative therapy just to see, once we had gotten the majority of the cancer out, I wanted to see if my alternative treatments would be enough to keep it away at a lower dose. Also, I had not taken any hormone therapy, which was also recommended. For about a year, I did photodynamic therapy and continued with a healthy diet and for me, that wasn't enough to keep it away. In February of 2024, about a year after the mastectomies, I felt 2 lumps in my armpit and the cancer had come back. So after that was biopsied, I decided to start seeing a oncologist and start doing traditional care. So she put me on tamoxifen, and Lupron basically shut down all my estrogen, put me into a menopausal state. And the cancer responded really well to that. The cancer shrunk very rapidly. I think within 6 months, the lumps were gone. And so I've been on the hormone blocking drugs for almost a year now. And about 9 months into the hormone blocking therapies, my oncologist said, okay, great, your scans don't show any cancer, but I want you to do a full course of radiation to the chest, radiation to the armpit. And that really took me aback because I was thinking, wouldn't we just radiate the 2 spots? But no, she wanted everything. And so that really gave me pause. I wasn't pleased with that idea. For about 2 or 3 months, I looked into other options, and quite honestly, she had me pretty intimidated, and I was about to do the radiation. But after research and after prayer and counsel and a lot of different weighing pros and cons, I decided that I was not going to do radiation and I was going to come here. The most meaningful part is just having the option, just knowing that there's a clinic that I believe, to my understanding, is reputable and yet gives you the option to have tailored care. At home, it is not tailored. It is a dose that is recommended for your type of cancer, no matter what your condition is. You and another person could have very different backgrounds and bodies, but you're given the same thing. And so what I appreciate about the Immunotherapy Institute is that they are willing to give you an option. They're willing to tailor things to you specifically. I recommend coming to the Immunotherapy Institute. I believe that I won't say it that way. I had a great experience coming. You guys took great care of me. The medical care is excellent. The doctors are knowledgeable. It's just different. I think the fear for people out of the country is just because it's different. It's different than home and you're not sure. But the doctors are qualified. They're very well educated. They take great care of the patients. Everything is the patient's taken care of as far as transportation, lodging, questions. Everything is smaller, so it's more personalized. And I feel like the fact that we, the patients, have access to the doctors all day throughout the treatment is great, because at home, you've got a short time limit with the doctor. You can't ask questions. Here, the doctor's sitting in the room with you. You can ask him questions. You guys are very professional and you make yourselves really accessible to the patients. But as far as medically, the qualifications that all of your staff has is excellent. And I would say don't be afraid to come. You're well taken care of. I've had a great experience, and it was satisfactory enough that I came back a second time without having any worries, and I've been safe. I've enjoyed my time. I would definitely recommend coming.